Thank you, sir.
Doctor, can you just tell us what are the common problems that you see in a teen?
Generally, it's cavities that is commonly seen in a dental patient, and also gum problems can happen to youth. Youth mostly maybe smoking patients, so it can cause certain deleterious effects on the gums also. So it's usually caries and gum problems that we come across in the youth.
So Doctor, we'll go to the questions.
Hi ma'am, I am Anupama Nair. I am studying 2nd MBBS in Cochin Medical College. I have a doubt about how often should we visit a dentist for a dental checkup?
Generally, we should visit a dentist every 6 months. Even if it's a patient who cleans the teeth regularly, still they'll be having food debris collected onto certain regions of the tooth which are inaccessible by the toothbrush. So saliva has got calcium and phosphorus in that, and this salivary calcium and phosphorus can deposit onto these food substances, and over a period of time it can become hardened and it becomes what is called as tartar or calculus in general terms, and which can cause gum problems which will lead to tooth mobility and tooth loss in future. So, and also cavities can go undetectable. Even if a person opens the mouth and sees in the mirror, he may not be able to see every regions of the mouth. So it can lead to cavities, and it's always better that you go to a dentist every 6 months. Even if you don't have any problem, it's better, it's recommended that a person should visit a dentist every 6 months.
Doctor, they say about the cleaning of tooth. How often do we have to clean our tooth?
It depends upon the amount of debris that you have. It depends upon the amount of gum problems you have, the cleanliness of your teeth. Generally, it is stated that cleaning should be done in every 6 months.
Will it lead to a sensitivity of?
Yeah, it's a common question. People generally come and ask whether tooth cleaning can cause sensitivity. Tooth cleaning is unlike drilling. It is just vibration that you do during tooth cleaning. It is ultrasonic vibration or piezoelectric vibration that causes, that takes away all these food, the hardened substances from the tooth. So generally it cannot cause tooth sensitivity. But what patients feel is when the root is exposed, root portions are generally sensitive, very sensitive than enamel portion, the crown portions. So when the instrument touches the root, it could cause some sensitivity, but that's for a short time. Yeah.
Okay, Doctor, we'll go to the next question.
Hi ma'am, I'm Anne Mary, doing 2nd MBBS at Cochin Medical College. I'm having doubt regarding how often should we change a toothbrush?
Toothbrush should be changed when they fray, but usually a toothbrush will last for at least 3 to 6 months. But when we read dental books, they state that it is better changing toothbrush every 3 months.
Okay, what are the techniques of brushing, Doctor?
Yeah, usually people, they go for a very hard brush and they brush very hard. But it can cause more harm than good. The method of toothbrushing is we brush from gums towards the teeth. From the upper arch you go from the gums towards down, and from in the lower arch you go from the gums and upwards towards the surface that we bite on. That is how you brush the outer surface. Inside also you can go horizontally, and the region where we bite, it's said that you don't need to brush very hard on the biting surface.
Okay, so Doctor, there are many types of brushes available in the market, like soft brush, hard brush. What do you suggest, Doctor, usually? What is the difference actually, and what do you suggest?
It's better using a soft brush, because as I said before, when you brush hard, the enamel, which is supposed to last a lifetime, it's said to be the hardest substance in the body, and if you use a hard brush, it can get abraded very fast. So generally it is good if you use a soft toothbrush and replace it when it frays. And there are other different kinds of toothbrush like baby brush, which can even be used in adult. I used to recommend that in persons who cannot reach the back surface of the tooth. You can go for a baby brush which has got a very small head, so it can reach the unreachable areas, which is generally not possible with an ordinary adult brush. And presently in the market we get power toothbrushes, which are electric brushes, like electric shavers. You can use it and it vibrates on its own. And this can be used in handicapped people and debilitated patients, cancer patients who cannot use their, or Parkinson's patients. You can use this power toothbrush.
Doctor, one more thing here. there are a lot of toothpaste available in market. So I'm sure all of them would have been really confused to buy which one to buy. So can you just tell them few tips?
Toothpaste, generally the content is the same. It's all marketing techniques that matters. If you, any toothpaste is quite okay, and there are different types of toothpaste also. You get toothpaste for sensitivity, ordinary toothpaste to brush daily. So it depends upon what kind of situation you are in to select a toothpaste. But generally it is a white colored toothpaste is
always
quite okay.
Better. Okay. Yeah. So what about a medicated toothpaste, doctor? Sometimes we have like for sensitivity.
Yeah. These medicated toothpaste, they block the tubules in the dentin, which is the sensitive layer of the tooth. Some people will have this dentin exposed to the mouth. So this medicated toothpaste will block all these dentinal tubules, the canals in the dentin, and this can cause this can prevent sensitivity for a shorter period. And there are other toothpaste which has got fluoride, which is recommended in people who have got an affinity for developing caries. So if you use fluoride, that will prevent bacterial action. So that is another kind of medicated toothpaste. So it depends upon the indication.
Okay. And what about this baby toothpaste, doctor?
Baby, yeah. Children, they are afraid of the taste and the burning sensation of adult toothpaste. So there are different companies which are coming with baby toothpaste which are sweet to taste and very good flavors like fruit flavors, bubblegum flavors you get, which is very good for attracting children into the habit of brushing. Yeah, and also the covers of these toothpaste are very colorful. So,
but is there any difference in the contents of the paste?
Yeah, baby toothpaste in areas which the normal water supply doesn't have fluoride, they supply fluoride into this kind of toothpaste. So toothpaste for kids also depend upon the area where they use, meaning the region where they live. If the water is less fluoridated, you will have baby toothpaste with fluoride in that. So medicated toothpaste are also available for them.
Okay, doctor, we'll see the next question.
Yeah.
Hi ma'am, I'm Bharata Ashok, second MBBS student of Cochin Medical College.
Okay.
I have a doubt. What is root canal treatment?
The tooth has got two parts. The part that is seen in the mouth is called as a crown, and the part that is embedded inside the gum is called as root. And there is a canal that enters the apex of the root till the crown, and this is called as root canal. And inside this root canal is the softest portion of the tooth, which contains blood vessels, nerves, and nerves. And when cavity develops, it pierces the enamel, it reaches the dentin, and it reaches the pulp if you are not careful. So once the cavity reaches the pulp of the tooth, it will result in great pain or more sensitivity. So in that situation, the only possible way to save this tooth, other than the method of extraction, to save this tooth is by root canal treatment, which means we remove the sensitive portion of the tooth, which is the pulp. The nerves, the tissues inside the pulp is removed, and this procedure is called as root canal treatment. And we fill this canal with an inert material. And after root canal treatment, it is supposed that we should fill the crown portion, and we'll put a cap on the tooth to prevent it from becoming distracted.
Hi ma'am, I'm Anne-Marie Augustine. I'm a second year MBBS student studying at Cochin Medical College. I have a doubt regarding should we replace a missing tooth? If so, what are the methods in doing it?
Teeth generally works in coordination to each other. They should always be in contact. Then only they can function properly. So when a tooth is missing, the tooth neighboring to the missing space tend to drift to this missing space to get in contact with the next tooth. The same thing also happens to the opposite tooth. When a tooth is missing in an arch, the opposing arch tooth, it will also tend to grow to contact the tooth on the opposite side to function properly. So what happens is this will disrupt the normal function of the arch. This tooth is not walking from the place it is there. It is just tilting. So what happens is there could be a gap developing in the rest of the teeth, a space developing in the front of the tooth, where there had been no problem till the time the tooth has been extracted. So it's always better to replace the missing tooth once the region has healed. And there are very different methods to replace missing tooth. The simplest method is to use a removable denture, which can be removed at night, and that is the simplest method. The next method is to do what is called as a bridge, a crown and bridge. What we do is we'll modify the shape of the tooth on either side, and then we'll put a cap on each tooth that has been prepared, and we'll have a missing tooth attached onto this, the caps that replaces the caps that goes on to the neighboring tooth. And the force that is being impinged on the missing space will be taken by the tooth on either side. So this is called as crown and bridge. The disadvantage is you tend to trim the tooth on either side. The latest method of replacing missing tooth is by dental implants. Dental implants are artificial root which goes into the bone, into the jaw bone, and on which we attach the tooth. So we can replace one tooth or many teeth with this dental implant. So that is the latest modality in this.
Okay. What about the primary tooth, doctor? Sometimes we do see, like in kids and all, the tooth will be broken. So mothers will be really worried whether to replace it or what to do with that.
The front tooth of a child falls off usually at the age of 6 years, and from the canines till the molars, they fall off at the age between 10 to 12 years. So if a cavity develops in the tooth which is indicated for extraction, which you cannot save by any other means, it is always better if you extract the tooth to maintain that space till the time of its normal falling off time. That is, if a molar tooth is extracted, we have to maintain that space with what is called as a space maintainer till 10 years or 12 years. But front tooth, usually because it falls off by 6 years, may not require replacement. The jawbone has got sockets into which the tooth rests. So once the tooth is extracted, the jawbone loses its function of supporting the tooth. So it recedes both in height and in width. Upper jaw has got double the surface area of the lower jaw. So that is why the complete denture patients have lower denture instability. The present impression techniques, with the present impression techniques, we can rectify these problems to a larger extent. But presently we have implants that has come into the market. What we do is we put implants in the lower jaw or even the upper jaw. We can put implants and stabilize these dentures. Or presently we can even give fixed dentures for these people, which is not removable. It will look like exactly like natural tooth.
Doctor, I want to know about dental stem cell banking.
Stem cells can usually be taken from umbilical cord, which has been the procedure that has been doing in India, and it can also be taken from bone marrow. And presently a concept has come that we can take stem cells from dental pulp. The tooth is extracted for many reasons. In a child we extract when the tooth is about to fall off. In orthodontic patients who are usually adults, the tooth is extracted just for cosmetic reasons. It is not infected, it doesn't have any caries. Wisdom tooth at the age of 18 or 20, sometimes it does not come off. At that time a non-infected wisdom tooth is also removed. So these teeth which are non-infected, these are potential areas from which the pulp of which the stem cells can be cultivated. And most of us would have missed an umbilical cord stem cell banking. So this is a beautiful area which can be harnessed to preserve stem cells. So, and the stem cells are saved at a temperature of about -200 degrees centigrade, which is called as a cryopreservation. And these stem cells can be utilized at any age for any damage to the cells. And the research is being conducted even to grow a tooth in a missing space.
Doctor, we have got one more mail. Can orthodontic treatment be done for adults?
Usually orthodontic treatment is done for adolescent people from the age of 12 or 13. The concept is that by the age of 12 or 13, all permanent teeth would have come. So presently, orthodontic treatment can be carried out even for adults. Up to the age of 65 or 70, people come for doing orthodontic treatment. In children, there are certain trainers, some silicone training appliances are available, which can be placed when the tooth grows, so that the teeth gets aligned according to the shape of the trainer. Hinges are just two plastic rims onto which artificial teeth are attached, and they have nothing to hold on. The upper jaw has got double the surface area than the lower jaw. So that is one reason why this lower denture usually rocks in a patient. The present day method to stabilize this is by good impression techniques, which is generally available in most dental clinics in the present day. But the latest trend is to put two implants in the lower jaw and to stabilize this denture onto these implants. We can even place implants, more implants in the upper jaw and the lower jaw, and even we can give a fixed denture which is not removable in the present day scenario.
So Doctor, it was really informative. Thank you so much. So guys, write your suggestion to us. Our email ID is youthdiaryrosebowl@gmail.com. See you.